name is Jonna Smith, and this is my community presentation. My area of focus was adult individuals with diabetes. Diabetes is a worldwide growing chronic disease. It is estimated by the year 2023 that 300 million people worldwide will be diagnosed with diabetes. One of the goals of Healthy People 2020 is to promote health and reduce chronic disease through eating a healthy diet and achieving and maintaining a healthy body weight. These two factors directly impact individuals with diabetes. Individuals with diabetes also depend on a medication regimen in order to maintain a healthy lifestyle. One study done by Kumar and his associates discovered that 34% of individuals with diabetes were non-compliant with their diabetic medication, and 85% of those individuals were non-compliant with their diabetic medication along with their blood pressure medication. The World Health Organization has defined adherence as the extent to which a person's behavior, taking medications, following a diet, and or executing a lifestyle change corresponds with agreed upon recommendations from their healthcare provider. While adherence sounds like a fairly simple thing to do, many of these individuals have competing priorities related to their finances that prevent them from even purchasing their medication. There is evidence of a relationship between poverty and type 2 diabetes associated with restricted access to adequate amounts of quality food. Davis, Chaffin, and Constantino did a comparison between food prices and biomarkers in adults with type 2 diabetes, and what their findings did show is when the cost of healthy food was high, the biomarkers were also elevated, but when the cost of healthy food was lowered, the biomarkers also showed that they were lower. So this in itself just proves that individuals purchase and consume what they can afford to buy. According to diabetes.org, the average cost of medical care is approximately $13,000 for an individual with diabetes. The University of Maryland did a focus study and learned that patients chose not to fill their prescriptions or take their medications due to financial constraint or family responsibility. 73% of these individuals made less than $25,000 a year. 66% of the participants had 3 or more chronic disease conditions, and 48% admitting to not taking their medication up to 3 times a week. Individuals with diabetes have to have a great understanding of self-care. If they don't take care of themselves, their disease process is just going to take over and they're not going to have a good quality of life. Self-care for individuals with diabetes should consist of blood glucose monitoring, nutrition to meet their daily needs, insulin dose adjustments, and physical activity. November 14th was World Diabetes Day, and I had the opportunity to partake in an education event with my preceptor. During that day, what we did was an education fair, and we promoted a healthy breakfast because individuals with diabetes, along with the rest of us, should always start their day out with a healthy breakfast. My responsibility this day was to discuss risk factors along with self-care to prevent complications. One of the first things I discussed with individuals that came to my station was neuropathy and the importance of doing daily feet inspections. I talked about making sure to wash their feet and dry them very thoroughly and to inspect them, whether they could inspect them themselves or have a family member or place a mirror on the floor, but I really wanted them to understand that they had to check their feet every day. I instructed them that if they developed a cut, an abrasion, a blister, that they needed to seek medical attention right away due to their healing process being slower than individuals without diabetes. The next thing that we talked about was the risk factors of hypertension and stroke. I explained that hypertension could be managed by diet and exercise, but many times they will be prescribed a medication, and it's very important for them to take that medication, and how high blood pressure can relate to stroke. We did go over the risk factors of that, and we talked about the signs and symptoms of stroke and seeking medical attention right away. One of the other things we talked about was how hypertension could also lead to kidney disease. I really tried to get them to understand the importance of taking any prescribed medication and making sure to increase their physical activity and also to eat a healthy diet, that these things all can reduce their risk factors related to that. We also discussed eye care and making sure that they see their optometrist at least once a year to get their eyes checked. I talked to them about the potential complications of glaucoma and retinopathy, and really explained to them how those vessels become smaller due to their blood being thicker, in relation to the increased amount of sugar in their blood. We did have some examples of fake blood. We had one bottle that would be an individual without diabetes, so it was about the consistency of water. The other bottle was an individual with diabetes, and that was about the consistency of corn syrup. So what we did was we allowed the individuals to shake those so they could really see how their blood is thicker and different from individuals without diabetes, and how their heart works harder, and how it's not flowing as quickly, so things take longer to heal, and really try to get them to understand that. One of the other things we talked about was making sure that they track their blood glucose levels. Many of the individuals that came through said, yes, I write it in a notebook, but typically I forget it whenever I go to the doctor. So what we talked about were apps that they could download on their phone or an iPad, a tablet, and how these apps were free. I gave them a list of the apps and told them to check them out and just see if they liked them, and how they could also record their dietary intake along with their physical exercise, so everything's in one place and they could take it to their physician when they do their follow-up visits. The other thing we talked about was making sure that they tracked those blood sugars, whether it was on paper or on an app, but their physician really needed to see those blood sugars to see how they're trending each day. I also gave each one a brochure. So that way it had the self-care tips in there that we discussed, along with the complications, and a list of the apps, just so they would have something whenever they got home. I would say that 95% of the individuals that came through the health fair that day were participants that worked for the hospital, but many of those individuals either had diabetes themselves or a close family member did. So they were there to pick up some information for them. The one thing I did not do that I wish I would have done was an evaluation to find out kind of their baseline understanding of the risk factors that they are set up for, and then to find out what they learned from my presentation. If I could do anything different, that would be the one thing, is to do that evaluation and to see if what I taught them actually meant something. The only other thing I would probably change is maybe giving them some tips on physical activity and dietary recommendations. They did receive these recommendations from the registered dietitian and the physical therapist that was there that day, but I felt like many of them, that's the information they were seeking out, and I wish I would have included some of that in there as well. As diabetes continues to grow and our resources become less and less for our individuals in the community, it's going to become really important as nurses that we take every opportunity we have to educate these individuals on the things they can do to take care of themselves. And make sure that they have a good quality of life. I really enjoyed doing my project with this group of individuals and teaching them what I could. It was a lot of fun. I learned a lot from my preceptor, and overall this community clinical has been a great asset to my knowledge base.